Hi class, I hope you're all having a good day. Here is my presentation on symptoms of pharyngeal cancer. I also went into other head and neck cancers because that was discussed. I didn't know where we fell on what we were going to do for that. And just a warning, we requested pet pictures, and I love my dog, so now you guys get to see Geffen in all her glory. Okay, Mayo Clinic has this spiffy website where it gives you every symptom and every disease. You can either look up a disease and find the symptoms, or you can write in your random symptom and then terrify yourself of all the diseases that you may or may not have. This one is particularly scary, I think, because it says in its early stages, nasopharyngeal carcinoma may not cause any symptoms. So right there, everybody could have it on the webpage. But if you do have any noticeable symptoms, they would be a lump in the neck caused by a swollen lymph node, which is what our patient had, blood in your saliva, bloody nose, nasal congestion, hearing loss, frequent ear infections, or headaches. So again, that's written more for a patient's perspective. Up to Date, on the other hand, writes this out for a practitioner. So here are head and neck cancers. We'll again start with nasopharyngeal carcinoma, and we see again a neck mass occurs in 90% of patients. So that makes sense with how our patient presented. Another thing that makes sense is they said that hearing loss can occur because of otitis media. I don't recall our patient complaining of hearing loss, but she did have the problems with her tympanic membranes. And other problems can depend on what the tumor is growing into as far as adjacent anatomical structures. So you could have muscle involvement, impaired functional cranial nerves 2 through 6. We also have sinus tumors, which can present with bloody noses, nasal obstruction, or patients with oral cavity tumors can have non-healing mouth ulcers, loosening of teeth. They can have trouble speaking, swallowing, leading obviously to weight loss, bleeding. And then 66% of patients with primary tongue lesions have cervical node involvement, whereas patients who have hard palate and lip cancers do not have cervical node involvement as often. Although I would think that someone with a lip cancer or a hard palate or even a tongue would be much easier to find on inspection. So you should be doing a good physical exam of the mouth. Some more symptoms, and here's Geffen showing you the inside of her nose, and it's cancer-free. So tumors of the posterior pharyngeal wall are asymptomatic, so by the time you do find them, again, it makes sense that you would have them in later stages. Again, it could be pain, bleeding, a neck mass, and then symptoms associated with cancer of the larynx depend on the location. So if you have glottic cancer, you might have hoarseness. Supraglottic cancers are found rather even later. So you might have metastatic palpable lymph nodes. Because subglottic cancers are rare, when you do have that, it's usually a metastasis from somewhere else. So a patient could present with dyspnea on exertion. Lastly, we talked a little bit about diplopia because our patient presented with that later. And there are, as Dr. Finch mentioned, a plethora of reasons why that may occur, why someone may have diplopia. So here are some problems. If you have something with your cornea, it will likely just affect one eye. So you could have an infection like herpes zoster, or you could have a complication of LASIK surgery, which would probably be pretty obvious if you just had LASIK surgery and then you walked out of it and couldn't see well. You could have a lens problem. This could be in one or both eyes, such as cataracts. You could have a muscle problem, myasthenia gravis, which would also present with ptosis, or Graves' disease, which would cause vertical diplopia, so the images would be on top of each other rather than next to each other. You could have a nerve problem, such as MS, Guillain-Barré, or uncontrolled diabetes, which usually presents in one eye, or a brain problem, which I think is sort of a funny way to say it, which could be a stroke, an aneurysm, or increased pressure due to trauma, bleeding, infection, a tumor, like our patient, or migraines. I hope you guys, again, all have a good afternoon and a good rest of your weekend, and I will see you on